Hey everyone, Pauline Lee here. We are outside Abbott Northwestern Hospital for day 2 of the Minnesota nurses strike. As you can see, we've got nurses out on the picket line. More nurses are trickling in as the day moves forward here. But day 2, we got 15,000 nurses from the Twin Cities and Duluth heading to the picket line here, standing strong for what they want in their contract negotiations. You can see they've got their huge setup here. You've got a couple of tents, you've got plenty of signs, plenty of water, plenty of supplies for the day ahead, as they'll be out here until about 6:30 tonight. But as I mentioned, they're staying strong to what they want. They want an increase in wages and they want better staffing. Now, in terms of increase of wages, they're asking for about a 30% increase over the course of 3 years. The hospitals are countering for about 10 to 12% over 3 years as well, citing hundreds of millions of dollars lost during the pandemic. So what they're asking for, hospitals are saying, is not reasonable. Meanwhile, you've got buses. We've seen 8 buses or so coming into Abbott Northwestern, bringing in traveling nurses from around the country that have been trained for the past few days just to fill the void as these nurses continue their strike. Now, the nurses out here say they would rather be inside taking care of their patients. Traveling nurses, they can be great. We've seen that play out during the pandemic, right? Traveling nurses, they fanned out across the country, helping hospital systems that were greatly impacted by COVID, give those hospital staff a little bit of a break, a little bit of a reprieve. But these nurses out here say what sets them apart is that they've had months, if not years, if not decades, to learn the hospital systems here. They know the ins and outs about how their floor works, how their department works. They understand this community because they're members of this community, and they understand how to take care of their patients, especially the patients that have been here for quite some time. They've developed that rapport with those patients. You can't necessarily get that if you are a traveling nurse, and that is a holistic approach in terms of caring for patients here, is what the nurses are saying. So day 2, as far as we know, there really is no timetable as to when both sides are going to get back to the negotiating table. In terms of Allina Health, we talked to Allina nurses yesterday. They said they reached out to the hospital systems hoping to negotiate, maybe end this strike early, but they have not heard back from Allina Health officials. In fact, Allina sent us a statement saying in part that they'd be ready to head back to the negotiating table after this strike ends, which, you know, in their defense, they've already taken the economic bullet, right? They've paid extra for these traveling nurses, more so than they pay their own nurses to fill a certain amount of time. So they've already taken that economic hit, and they've also had to reschedule some elective surgeries and procedures that aren't necessarily deemed imminent, that they need to happen right now. So they've already taken those precautions. So they say, hey, you know what? Let's wait until the strike is over. We've already planned for it. And let's take the time after this strike to come to an agreement that everyone can be at least somewhat happy with. So as day 2 gets underway, more nurses are trickling out onto the picket lines here. 15,000 nurses, again, from Twin Cities and Duluth. They're hitting the picket line for day 2 of this historic strike. We'll have more updates on air and online at WCCO.com. For now, reporting outside Abbott Northwestern, Pauleen Lee, WCCO 4 News.